Hi, I'm Claire Marie Miller. I am Nurturing the Mother. I've developed that course in 1990, and I'm a continuing education provider. I teach all across the country. Hope you can join me sometime. I'm going to demonstrate a few techniques with Tara here. So I'm going to have you first lie down. This is the sideline positioning system that Oakworks developed. And there's a couple of different ways you can use it. This is a wonderful pillow cover because so often our pillows are used by many different clients, and we don't want to have any kind of crossover with bacteria or anything else. And in many states, this is also very important legally too, to always be covered. So this way you can use your body cushion, your body pillow. And you notice the first thing that I want to really check is that her legs are in alignment, that her hip, her knee, and her ankle are in a nice alignment. I'm mostly going to demonstrate now the lymphatic drainage on the legs, which is really important. Pregnancy-induced edema is quite common. Most women will have it from the knee to the ankle. And what you want to do is you want to start with draining up by the upper leg. So it's a very light technique. I'm going through clothing, but normally you would be on skin. And it's just pressing up toward the hip, and that will help to drain some fluid. And then you want to open the knee a little bit, and you're going to come from the back of the knee, and you're going to release some of the fluid that way. And then we're going to come into the lower leg, and we're going to also pump up. So you're always headed back toward the heart with your lymphatic drainage, much like you are with Swedish massage. I might even suggest to my client that she do a little bit of pumping when she's at home laying on her side, and that she also use a lot of pillows or a very dense pillow to keep that leg up higher. Because if it were down low, you can see water is going to follow to the lowest point. So you always want to keep it up high. And this very simple pumping action will help to move that lymphatics. You might do a little work in the back. A lot of people are concerned because there's a reflex point right here. But when you're working very lightly, you are not going to stimulate a reflex point that will get her into labor. That's not going to happen. We're also going to work across the top of the foot. And you can see from this how important it is to actually feel this, because as you look at my hands, you might think I'm working deep, but when you're in a classroom setting, you can really feel that it's a very light touch, it's a drag on the skin, and so I hope that you will take classes on site as well, because it's really important that we protect our pregnant women and their babies with good education. I hope you join me sometime. Thank you.